thing's a lie. Quiet down.
Well, so you can protest and nobody else can? What gives you the right to protest and nobody else can? We all have the right to protest.
That's on fire.
I can stand right.
Let me slide in inside here.
Alberta Darling has got to go. Hey, hey!
Alberta
Darling has got to go. Hey, hey! Alberta Darling has got to go. Hey, hey!
I need to take video.
Alberta Darling has got to go. Hey, hey!
Form a line around that circle so we can get over that ride.
Has got to go. Hey, hey!
Don't let the circle be broken.
Alberta Darling has got to go. Hey, hey! Ho, ho! Alberta Darling has got to go. Hey, hey! Ho, ho! Alberta Darling has got to go. Hey, hey! Ho, ho! Alberta Darling has got to go. Hey, hey! Ho, ho! Alberta Darling has got to go. Hey, hey! Ho, ho! Alberta Darling has got to go. Hey, hey! Ho, ho! Alberta Darling has got to go. Hey, hey! Ho, ho! Alberta Darling has got to go. Hey, hey! Ho, ho! Alberta Darling has got to go. Hey, hey! Ho, ho! Alberta Darling has got to go. Hey, hey!
Okay.
Ho, ho!
Let's go.
Get started. Go. Yell.
Hey, everyone.
All right!
Look, we're here on the birthday week of Medicare and Medicaid. This used to be a time for birthday cakes and balloons, but we're doing a funeral because they are under grave risk. And they're under grave risk because Alberta Darling supports a radical plan to So by recalling Alberta Darling, we hope to save Medicare and Medicaid of a real birthday party. So that's why we had this funeral procession, to let people know that something that's very important to them, something that the vast majority of Americans support and people in this district support, is being undermined by Alberta Darling, by Paul Ryan, and by the far right in this country. And that Medicare and Medicaid are under grave risk. And they, in fact, are at risk right now with this debate over the debt limit. And they're at risk because of Paul Ryan's plan, and because of what Alberta Darling supports nationally, and because of her attacks on Medicaid in the state budget. And so... Alberta Darling stands, and is on tape, it is on YouTube. She supports a radical attack on Medicare and Medicaid. And so, I also want to ask here, Diane Palmer, the president of SEIU Healthcare in Wisconsin, a nurse who has fought for Medicare and Medicaid for years, to say a few words about why this is so important.
Thank you, Diane!
In support of Medicaid and Medicare. You know, there's folks here who are not respectful of our rights to peacefully assemble. And I want to say shame on them. I am indeed a nurse, and I have worked for almost 30 years on taking care of people and the elderly. And that's what I'm going to share with you, the truth. I'm going to share with you the yes votes that Alberta Darling made. Alberta Darling made a vote to cut $500 million from Medicaid in Medicare. Alberta Darling voted to the bill to reduce the income eligibility for Badger Care. That's true. Alberta Darling voted to cut $111 million over 2 years from. So these are the truths. You can look them up on the internet. They are the truth, whether you agree or disagree. Alberta Darling is wrong for Senate District 8. Alberta Darling is wrong. My life has been dedicated to helping people get better and not making cuts so that our ill and our low income and our middle income family cannot receive the care that they so rightly, so richly deserve. So Alberta Darling has to be replaced.
Replace Alberta! Bye-bye, Alberta! China, go!
Alberta Darling has lost her way. And when somebody loses their way, they must be replaced. We cannot just have a pity party and go about our business. We must replace Alberta Darling with a registered nurse who cares about health care of our citizens.
Amen.
We are in the day of technology. You can look the truths up for yourself. You don't have to take my word. You don't have to take their word. Alberta Darling stands on the wrong side of Wisconsin citizens.
The truth is deadly.
That's right.
And so I think the message is getting across. I think that's where all the reaction is, right? They don't want the truth to get out.
That's right.
I think the people know the truth. That's why these plans are so incredibly unpopular. They're out of step with the values of this district and of Wisconsin and of the whole country.
That's right.
There will be a judgment day. What's judgment day? So, thank you very much, everyone. Thank you for really sending this message clearly. You need clear symbols right now to get through all the noise and all the untruth and all the attempts to obscure the truth. And this is the way to do it.
You're misleading your people.
All right.
Truth!
You say recall, you say darling. Recall.
Darling! Recall! Darling!
When I say recall, you say darling. Recall.
Darling!
Recall.
Darling!
When I say recall, you say darling. Recall.
Darling!
Recall.
Darling!
When I say recall, you say darling.
Recall! Darling!
Recall.
Darling!
We have another nurse to say a few words.
Thank you.
I am an RN at the Milwaukee County Behavioral Health and have been for 6.5 years. And I just want to say that most of our patients are almost totally dependent on Medicare and Medicaid.
That's right.
And I want to say to all you Republican supporters out here that if you want to see more of our mental health patients on the streets and crowding the jails, keep voting. That's exactly what's going to happen if this plan goes through.
Tell the truth. Thank you. Thank you.
Thank you! 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 Thank you!
Okay, so dearly beloved, thank you for coming to this grave occasion, and we hope to make it a lot less grave. We hope to bring this patient back to life.
Yeah, right. Medicare lives.
The nonprofit, it's a 901 website.